Toastmaster, fellow Toastmasters, welcome guests. Today I'll be talking to you about back pain. And my father, growing up, experienced back pain my whole entire childhood, and that's what initially got me interested in the topic about back pain. My speech is about get to the point, so I'll do just that. And my objective is to teach you a little bit about the conditions associated with back pain and what treatment options are available for you. Some interesting facts about back pain are that Americans spend over $50 billion each year in costs regarded to back pain and treatment. Back pain is the fifth most common reason to visit a physician in the United States. And over half of Americans, working Americans, report experiencing back pain within the past year. Those that experience back pain, 90% end up getting better within the first 7 weeks. The other 10% actually get worse, and that's called chronic. The conditions that we'll talk about that cause back pain, and I've brought to show you here a spine model. It's important to understand a little bit about the anatomy of the spine. I'll talk about the cervical, which is your neck, the thoracic, which is where your organs are located, and lumbar, which is the lower back. With the cervical, there's 7 vertebrae, thoracic there's 12, and lumbar there's 5. And the discs separate the vertebrae. So the discs are basically like shock absorbers. Well, as we age, and everybody ages, we get what's called degenerative disc disease. So you literally lose the plasma in the water that's in the disc. When these discs shrink, it causes these vertebrae that the discs separate to get closer together. This oftentimes will cause the canals that the spinal cord runs through, called the spinal canal, and the canal that the nerve travels through, called the foraminal canal, to get smaller. This is a condition known as stenosis. Stenosis causes weakness in the legs if it's lumbar, your lower back. It causes weakness in the shoulders and the arms if it's the cervical. Another condition is what's called bone spurs. It's a buildup of calcium, and these bone spurs can touch the spinal cord and the nerve and cause the same type of symptoms. Bulging herniated discs are also a very, very common condition. The disc material actually protrudes through the disc wall, and if it touches the spinal cord or the nerve, you have symptoms. The nerve doesn't care if it's disc material, bone, or arthritis. Something's pressing on it, you're going to feel it. The last condition we'll talk about is you have facet joints, which allow the vertebrae to glide, to move, and these facet joints have small sensory nerves located inside of them. When they become inflamed, that's called facet disease, or better known as facet arthritis. So when people have these conditions, they oftentimes will experience symptoms such as weakness, as I mentioned earlier, nerve pain, which can cause burning, it can cause radiating symptoms, it can cause tingling and numbness. When you experience these symptoms, you're going to seek out treatment, and the different treatment options are you can consider having physical therapy, you can take prescription medications, you can go to see a pain management doctor that will offer you epidural steroid injections to basically numb the condition, or you can consider having surgery. Surgery should always be a last resort. Now, when you consider having surgery, there's different types of surgery you can consider. A conventional method would be they actually remove the whole back portion of the disc. They take out the whole lamina bone, and if they left it alone, there'd be instability. So what they do is they go in and stabilize with plates and screws. It's a very invasive surgery. It's about a 5-inch incision. They have to cut and tear the muscle to get to the spine. A lot of bleeding involved. That leads to scar tissue. The problem with that is when your portion of your spine is fused, it puts a lot of pressure above and below the fusion site. That leads to further conditions forming, such as bone spurs and stenosis. Another type of more popular technique that's really starting to change medicine is an endoscopic approach. Has anyone heard of arthroscopic knee surgery? Okay, it's the same exact dilation tube. The only difference is it's called an arthroscope when you work on joints and an endoscope when you work on discs. So what they do is they don't cut or tear muscle, they dilate the muscle. They don't cause any instability, and that's why they never have to go back in and stabilize with hardware. There's no rods, screws, cages, or plates involved. Those are the different treatment options, but obviously you want to avoid having surgery altogether. And to do so, the best opportunity for you to avoid back pain in the first place is to maintain a healthy diet and exercise. Live an active lifestyle. Very importantly, to stretch before you do physical activities. You want to maintain proper posture when you're at work. You want to work in an ergonomically correct fashion, and you want to wear comfortable shoes. Sleep on a mattress that has medium firmness. This will avoid any curvature in your spine that can lead to problems in the future. And you want to lift with your knees and not your back. A very important one is not to smoke. Smoking actually impairs blood flow, which will cause conditions to form in the future. With that being said, if you follow these suggestions that I've laid out for you, you can avoid having the back pain symptoms that will cause you to have to seek treatment in the future. Thank you.